John Erickson from RapidBio.
That looks familiar. Cool. Before I start, let me ask you a question. How many people in this room have ever had food poisoning? You know what? It's a lot. You know, the CDC says that this year, 1 in 5 or 1 in 6 of us will have food poisoning. Absolutely astounding, isn't it? Well, I'm John Erickson. I'm the president and CEO of RapidBio Systems, and we're about making fast pathogen detection easy and simple. The mission of our company is to support our customers' needs to dramatically, and I mean significantly, decrease the time for pathogen testing. And when I mean pathogens, I mean bacteria, not viruses or prions, to help provide a safer food supply for the world. So the food safety testing business, it's a pretty significant business. It's over $9 billion. It's growing at a 5 or 6% CAGR, made up of several different components. But in that large market, slow pathogen testing, and I'll explain that term in a minute, is costing the food safety business hundreds of millions of dollars. So you can see a lot of brands, and I see some familiar faces in here who are associated with some of these very significant billion-dollar global brands. Big brands, big issues, big risk associated, and issues with foodborne pathogen testing. So, for example, down in Salinas, an hour south of us, where some of our friends are from, you can see some of the production facilities, the fields. At every one of these points, whether it's production or it's processing or it's distribution, there's a testing opportunity and a test that takes place to monitor the product for pathogens. What we're looking at is we're looking to change what is typically hours to days in pathogen testing to a matter of minutes, so a significant change in time. I'll give you a for instance. Dole Fresh Foods, again down in Salinas, they sit and they have about, they don't sit, they're very busy. They carry over $1 million worth of inventory every day waiting for pathogen testing results. Unbelievable. The time, the cost of capital, the opportunity there is just tremendous. So again, the market is big, it's over $9 billion. Quote unquote, the rapid part of this testing, which is complete misnomer in my opinion, makes up about 60% of that, so about $4 billion. What's curious about this is 4 pathogens make up 96% of this total market. There's 3 big guys, the 3 big gorillas like there are in most markets. And these companies are servicing the markets with PCR-based DNA analysis and other technologies that take a very long time to get results. And so I'll use Dole again, as my friend Tom Mack was saying. He goes, John, we need a fast, easy to use, accurate and reliable portable system for foodborne detection. Pretty clear need. Well, that's what we're all about. We're to supply that. Apologize for the picture. It's a picture of one of our prototype devices that's portable, handheld, easy to use, and will give a PCR-like result in about 10 minutes. I think this is going to be disruptive in the marketplace. We've got an interesting business model in that we will sell the devices and we have a consumable trail, 1 test per 1 slide for each one of the pathogens. We've got 3 submitted US patent applications and 2nd PTO review and 2 PCTs as well. So kind of an ugly picture, but well, that's kind of funky. You can see what we're looking at. This slide, which is this slide in my hand, with a spinach sample in it. Oops, pardon me. So this just shows you a little bit of what's going on in the competitive set, whether it's an auger plate or some type of rapid test. But a PCR test, big, expensive, costs tens to hundreds of thousands, needs technically competent people to run, and it takes about 16 hours to get a result, sometimes less. Ours, 10 minutes at a much lower point. So what we're going to do is bring point of testing modality into this particular food safety space. So again, the model being a printer you have an installed device with a consumable trail. We're looking at raising $1.5 million in a convertible debt against a Series A right now, and we'll look to have a Series B later as well. So with that, I think we're developing the right product. There's clearly a very clear stated need for this product in the marketplace. We have the right time to do it with the right product and the right technology. And so, although this is fast, 5 minutes to get through everything, you can check us out at rapidbiosystems.com. There's a lot more information, and I'd be happy to answer any of your questions.
Great. Thank you, John. Pretty deep. Hands up high.
So what I was saying, he asked, so what's our typical company or customer profile? I said, we're pre-commercial. We're in the finalization of optimization of our system in beta level development. We expect with this next capital round to take us out through a significant field trial. And by that I mean 1,000 to 2,000 samples with Dole, Chiquita, many other places, University of California, Davis, University of Arizona, et cetera. So we're not going to change protocols of what they're using. We're just going to increase the speed and time in accuracy, not so much accuracy, but speed and time, in some cases, accuracy of result. Okay, sorry.
And,
yeah.
What do you think of the milestones before you'll actually be able to be used en masse with these big corporates? So what are the steps before you replace the existing test, in your opinion?
Yeah, great question. So what do we need to do? What milestones will we need to meet to, first of all, commercialize and then expand and enhance the business itself? So the business model itself, we need to finish the optimization and then go into prototype development and in the significant field trial. Based on those positive results, we will then go out and have a third party do the AOAC testing, which is the International Analytical Chemistry Society, who owns the protocol for these pathogens, get certification, and then we can go to market. So those are some significant ones. We're going to go through a strategy I've done when I've been at Johnson & Johnson and Abbott Laboratories. I've run global businesses of significant size, over $1 billion. We're going to crawl, we're going to walk, we're going to run, meaning we're going to go at very targeted customers first, learn and expand, and then we're going to be expanding the profile and iterating the device itself, and then we'll go on a global basis. Exact same model I've used in clinical diagnostics successfully several times in my career. Good question. Yep.
There we go. Is there a model of this device, or is there a future for this device that would be seen, in small business or for independent farmers and not larger corporate models?
Absolutely. This isn't constrained by corporate size. Anyone could use this device, whereas, whether it's an independent grower or it's a corporate large producer as well. Yeah. Yeah.
To piggyback on that last question, what's the level of proficiency somebody needs to have to use this device? Could I use it today, or do I need to be a biologist and to understand how to use it?
You know, that's a great question. So when we finish optimization in the final prototyping, what we're going to do is exactly what I did in the diabetes space, and this will be an icon-driven menu. So one, you don't have to speak English, you just follow icons, and in 5 or 10 minutes I could train you to run this device. You don't need to have a degree in biology or chemistry, so you don't need to be a highly technical, competent person like the people currently running PCR. Good question. Yep.
Question for you here. Which pathogens are you going to target first?
So there's 4 that I said make up the 96%, right? So Salmonella, E. coli, Listeria, and Campylobacter. There will be others, but those would be the 4. Mm-hmm.
Is there a plan to do anything with the data?
Can you start again?
Is there a plan to do anything with the data, like on a broader measure?
Yeah, there will be. At this point, no. Probably the first 2 commercial devices, it'll be data. It may be wirelessly connected to the company's own quality control system, but we expect in future iterations to do more with the data, right?
How do your false positive, or more importantly, false negative data compare with the incumbent technologies?
So I didn't hear the first part of the question, so it's where?
The false positives or false negatives of the test kit, how does it compare with the incumbent technology?
Yeah, so one of the things that we will do when we finish our optimization is exactly that, is test it against the AOAC protocol. So today I can't give you an answer where we are in false positives, false negatives, but I can tell you we're down at the same level of detection as PCR is, okay? Yeah.
Do you expect growers to use this on an as-needed basis or as a spot check basis?
You know what? The growers are going to have to make that decision. We're going to be supplying them with a tool. I see you're laughing at it. growers and producers and distributors, they're going to have their own HACCP plans in place through the FDA. What we're going to do is supply a tool for them to use and augment and enhance their current testing strategy and modality.
All right, John, we're out of time.
Oh, there we go. Okay, very good. Thanks.
Nice work. Thank you so much.